let's have somebody come on up here and sit, maybe at this middle table. All right. So sulcus sign is super simple. You want to have the hand resting, okay? So you just want to get them as relaxed as you can, all right? So you want to feel for where the sulcus is. The sulcus, which is kind of just the space between the acromion and the humerus, the subacromial space. That's what you're trying to reproduce. See how much of a sulcus you can get. So all you're going to do is just take the humerus distally and try to pull down, palpate with your fingers here right over that subacromial space so you see how much of a distraction you're getting there. You can do it at 0 when it's more of the superior ligaments. Relax. So now I've got my hand on the acromion. I'm going to slide right off so I'm in that groove and I'm on the proximal humerus. Relaxing that arm, and now I'm going to push down and see if I can create a sulcus that way. And then I'll come up into 90, same thing. Relax. So he just naturally tensed, and that's, that's very natural, and he's theoretically not in pain. So get him to relax and just get that sulcus sign. If they don't have a shirt on, you'll feel it because you'll kind of feel your finger just kind of get sucked into that little sulcus that's created because they're unstable. So you're looking for a multi-directional instability or at least an inferior instability so that humeral head is moving down too much, okay? Load and shift. You're loading through the elbow, all right? So now I'm loading that joint, almost like the scour test that we did. You can just load and shift this way. So right here, I'm gonna go towards the top of the shoulder. I'm loading top of the shoulder, maybe at 45 with a little external rotation. I'm trying to create an instability out here, then coming up to 90 here. Those are anterior load and shift, so I'm loading with this hand. I'm shifting with this hand with my thumb.
Are you moving it like forward?
Yeah, so I'm trying to push his head of his humerus forward.
Okay.
So I'm loading and then shifting. Okay, and you can do the same thing posteriorly. Take a couple fingers, drop right off the acromion, internally rotate horizontal adduct, and shift posteriorly. He doesn't relax real well.
Yeah.
All right, so that's your load and shift. So you can get a lot of different things that way. And if, go slow to start out with, and, the multi-directional instability patients, the kids that are like 13, 14, 15, they're super easy. They're usually small arms and they're so loose, and those are the patients that you can kind of test on a little bit. And it usually doesn't hurt them if you don't push too hard. Okay? The other test, which I don't remember the name, I'll put your hands on your hips, is just stabilizing here and pushing forward like an anterior shear. So I'm trying to get that superior labrum by pushing through the elbow. So I'm loading that humerus that way. Okay? Okay, practice those real quick.